Hello, everyone. My name is Radha, and this is my presentation on mental health and substance abuse. So, while I was reading the textbook, the part that I came across that I was surprised of was the part about the psychoactive substances, that there were consumers who used the sleep-inducing wake-up pills, nail polish removers, aerosols, alcohol-based hair lotion, glue, cough syrups, spray paints, that they were using it um, to consume it or to mix it with other things. And the part that I was more surprised about was that this list is responsible for a high number of suicides, and therefore you can't just buy it over the counter anymore. You have to show your ID in some places and you have to register your name for them. Um, the part that I wasn't surprised about that I actually as a paramedic that I have had to deal with through my career as a paramedic was that illegal drugs that are being manufactured by inexperienced chemicals in the lab by just regular people. That the street drug dealers are always often diluting the drug, and a lot of times it would have contaminants in it, and a lot of the contaminations would include cough syrups, or it would include um, other things that's over the counter, such as the nail polish removers, and they would dilute it with the drugs and what other unknown materials that the drug seekers don't really know what's in the drug that they're doing. And they're really unaware of it. And they're just seeking a certain type of high. And when they consume it, they might have an unintentional overdose, or they might have a side effect that they were not expecting. And in that situation, it might lead to a medical emergency, and it might be difficult to control as it's an unpredictable for the EMTs and for the paramedics. And this situation really places a level of danger to 911 responders. And also for the three things that I learned about mental health and substance abuse. For substance abuse, I learned that the synthetic anabolic steroid is considered a substance abuse. I've never really thought about it as being of a substance abuse. It's usually taken by athletes and bodybuilders, especially that people with eating disorders will take it to build more body mass and enhance their performance. Marinol, which is an active ingredient of marijuana, is actually legal and available for the controlled treatment for nausea and vomiting and wasting that is associated with cancer, chemotherapy, or immunodeficient syndrome that I also was not aware of at all. And often the cycle of substance abuse starts with the process of needing to take a depressant to relax or sleep. And then this same individual might need a stimulant to wake up. And the need for these drugs might also increase. As someone who also needs coffee always to wake up, it might be part of the cycle one day. For mental health, um, mental illness is classified by using the DSM category, which is the Diagnostic Statistical Manual of the Mental Disorder. I just learned all about that and have been reading about it ever since I read it in a book. And many mental disorders have a genetic component. More importantly, stress may also play a role in the development of the illness, which this is something really important to identify as a provider. And first generation antipsychotic drugs, which is also known as the typical drugs, can cause Parkinsonian signs such as excessive extrapyramidal activity. With prolonged use and high doses, the individual can actually have tardive dyskinesia, which is irreversible. And with the second generation, um, antipsychotic drugs, the atypical drugs can also cause diabetes as well as weight gain. For patients who have gained weight and high blood sugars, it might, who are also on these antipsychotic drugs, it would do them well to check their list and see as to why they're gaining weight if there are on those medications. For for number four, the people who are on narcotics for a prolonged period of time, they risk becoming dependent on those medications, because these drugs are addictive and they create a state of euphoria while getting rid of their pain. About 21 to 29% of these patients who are prescribed opioids for chronic pain, they end up misusing them. And 29% is a very high percentage. And about 80% of those people who use heroin um, are they start with misusing their prescription opioids, which is very detrimental in the medical world. Um, so knowing those percentages and knowing what could happen from being on opioids for a long time, it's really important to recognize that substance abuse is hard because the pattern of taking it varies from one person to another. Some people can function very well while they're consuming a very high number of prescription pills or misusing it in other variety. Um, and like I stated before, some atypical antipsych meds can cause diabetes. So the provider really has to look at the patterns that's in front of them and recognize the individuals who are at risk factor for developing such um, an addiction. We really need as providers to look at the whole picture and avoid tunnel vision. We're treating the individual as an individual and not just a symptom or a diagnosis. And while we're in our office, we really have to create a safe, non-judgmental environment for these people, and so they can really trust us and help us help them to get over this addiction and help them as much as we can. Um, for the certification track, so after being a paramedic for several years, and going to nursing school, becoming a trauma nurse and a critical care nurse for approximately 5 years now. Um, I'm applying for the CRNA program and also doing the Psych NP path as well. So my track would be just to hopefully go to CRNA school, graduate from there, take the national certification exam, do a CRNA fellowship. And my specialized area would be chronic pain management. And hopefully one day I'll be able to help these people really control their pain and lessen the percentage of people who misuse the the medications and really get rid of their pain as much as we can while trying to get rid of the the negative end of things. Thank you so much for listening to my presentation. I hope you enjoyed it, and thank you so much for this whole semester. Thanks.